It began as a response to increased violence in Louisville, but quickly grew into an award-winning program serving hundreds of children. Future Healers is not only showing young people a healthier way to live, but it's also shaping the next generation of healthcare professionals.
Future Healers started in 2020 during a time of particular civil unrest. It was a violent year for Louisville, and it really started when some medical students kind of looked at their situation and said, hey, we feel like we want to do more for our community.
The medical students, the doctors, our organization, 2X Game Changers, we thought it would be great for them to have this interaction with the first responders who deal with these kind of issues.
Every month, a team of 6 to 12 medical students will meet and kind of just go through different ideas on how we can teach kids about their body in a fun and engaging way.
Good job, good job. Staying alive, staying alive.
So I think just kind of taking an approach of education with like hands-on kinesthetic learning has been pivotal to the success of our program.
You come here only one Saturday a month, so when you come here, you do things you like you do CPR, or you learn how to stitch people up.
I've been coming here for 4 years, and I've learned a lot about being a doctor and being a nurse and being like a veterinarian, and it gives me a lot. It teaches me a lot.
I thought I was just gonna listen to some people talk, but then it was so much more. It was more experience and hands-on things, and it was really amazing.
I learned about how to help people and what to do when they're hurt.
I want to be a doctor in the future. Some stuff would be easy for me because I already learned it whenever I went back to Future Healers. I can remember it. I can remember what I learned, and it's worth coming here.
These kids are so smart. They're learning, they're retaining, they're coming back, and they're bringing that same knowledge, and we're adding on and expanding to it. But it's really inspiring to see kids who might be coming from underserved areas or exposed to certain situations, and really come here with a bright smile on their face, and they're eager to learn and eager to work with us.
Medical students have embraced this connection in a real full thrust way, with especially urban kids, to let them know that I want to sacrifice my time to be with you with all of my challenges with studies, right? And preparing to become a physician one day. But I want to sacrifice my time because you're worth it, and the kids feel that, the parents feel that, and that's why we've had this growth.
I mean, they're really great trauma surgeons here at U of L at this amazing trauma center that she can go talk to, just normally that would be very intimidating, oh, he's a very fancy doctor, or she is a very fancy doctor, how could we go talk to them? But they're very down to earth, and you can ask.
It takes us an hour, so we're coming from Radcliffe, Kentucky, all the way to Louisville. So we've really put in a lot of effort and dedication to come to this program. It is well worth coming.
If it wasn't for the parents, this program wouldn't run, right? They are responsible for making sure that their kids show up and show out one Saturday a month. But also I think the parents learn a lot.
97% of the parents that bring the kids to the Future Healers Kiddos Medical Program stay and witness every bit of it. That's been part of our success.
One of the greatest things that I do love about this program is the diversity. He's able to see doctors, and he's able to see people who look like him as well. To be in this program to say, listen, there's no excuses. You don't have to let your environment dictate your future.
I didn't realize how much these kids actually look up to us as medical students, of people of color. So it really makes a huge difference. It's more than I realized.
So I think giving them the exposure to healthcare and being a cheerleader for them is hopefully going to help out in the future with getting folks more interested in healthcare and instilling the belief early in them that they can do it if they set their mind to it.
I think she's kind of I can do this. This is not some pie in the sky thing. I can do this, really do it.
If none of them decide to go into healthcare at the end of the day, that's okay. It's that sense of living within a community and helping those around you. At the end of the day, if that's what's accomplished, then it's a beautiful thing.
If you give a kid a chance, and if there's some professionals that can sacrifice their time for the goodwill of children, great things happen.
Christopher Tueck says the program is impacting more than 400 kids, and he expects that number to increase. The program has also expanded into 3 Jefferson County public schools and even into Tennessee through a partnership with Vanderbilt University Medical Center.